Our next question comes to us via Twitter from @HendrixMarie, and it reads, I take aspirin when I get a headache, but what exactly does it do in my body to make the pain go away? This is a good question because almost 30 million people, when it comes to adults in the U.S., consume 10 to 20 billion aspirin tablets each year. That's a lot. And aspirin works in a similar way to ibuprofen. I'm going to show you how. So pain is really something perceived by your brain, an insult to your body. Say you burn your finger or you hit it with a hammer. That sends pain signals all the way up to your brain. But it's driven by chemicals, and in particular something called prostaglandins. But in order to form that chemical, you need something called COX-2. That's an enzyme. Aspirin actually prevents the function of COX-2, so you don't create prostaglandins. So what it does is it turns down the volume of pain perceived by your brain. So it doesn't make the pain disappear per se, it just turns the volume down. So that's why people, when they take aspirin or other over-the-counter pain relievers, you'll say, you know what, my pain's improved. Rarely will someone say, oh, it's totally gone.
Right, just a little bit better. You know, one important point, where kids should never get aspirin. You can give them ibuprofen or acetaminophen, but never aspirin unless your doctor tells you to directly.
And the number one difference between aspirin and something like ibuprofen is aspirin is also known as an antiplatelet medicine. It's why people take it who are at risk for heart disease. I know, Dr. Warden, you take a small baby aspirin every day.
I do. Anybody who's at risk for heart disease, stroke, anybody who's had those problems typically is put on a small dose of aspirin. But if you're taking aspirin, very important to tell your doctor before any elective type of surgery, even something as small as a dental procedure. If you're on aspirin, because of the antiplatelet effect and bleeding, it can cause excessive hemorrhage, or lead to excessive hemorrhage. So make sure, typically you want to come off of aspirin for 2 weeks before any elective procedures.